pleasure to introduce today's speakers, Dr. Peter Cole. Dr. Cole is assistant professor in the Department of Geography, HKU. He received his BA and MA degree from the Seoul National University and a PhD from Michigan State University, and postdoc training at Ohio State University. So he is associate editor of the International Journal of Health Geography. So Dr. Cole is a health medical geographer, examining various topics on human and animal health, food environment, and racial health inequality by leveraging data-driven research method. That's basically one of the key topics for today. So his latest research project focused on using agent-based modeling for health issues like COVID-19 and physical activity. So without further ado, welcome, Dr. Cole.
And good morning or evening on June participants. Yeah, thank you for coming. Yeah, I'm Peter Cole, and then I'm health and medical geographer. But my research topic overlaps lots of multidisciplinary, interdisciplinary, like economics, urban planning, public health, and data science, etc. And today I would like to share what I have done so far using agent-based model to address two social problems in our days, COVID-19 in Hong Kong and food security in Columbus, Ohio, United States with you. Before talking, I would like to thank you all of these agencies and institutions and my collaborators for their support. And I also want to thank the faculty Method Hub for having me here today. And then I really appreciate Professor Fu to leading the event. Okay, and then there is no shortage of literature about agent-based models or system thinking, system sciences, and then related theoretical background. But among them, those are two of my publications, from which you may find some more details about my talk today. And then this one is quite good, the textbook, which you can have some good overview of the general system science. So then let me share some background information about agent-based model with you. So one issue that traditional quantitative analysis method based on positivism or reductionism has often criticized by its simplification or oversimplifications. Okay, so I don't know, you guys see this picture big or not, but let's think about that, as you can see here, the car price with its 6 variables. So car price is related to engine size, horsepower, RPM, and length, width, height, all that. Okay, so I think this, the way of the thinking is quite reasonable, right? So think about that. The car price should be bigger engine and then bigger functions in there, right? So this is a good way of the thinking. But let's think about that. Some issues in here. This equation is really perfect or not. So first, engine size and horsepower. So if the engine size is big, then definitely the horsepower should be a little bigger, right? And at the same time, RPM is 2, right? So that's one thing. So then also, how about the other things like legs, width, height, right? So it also, in general, if you are driving bigger car, then definitely you have the bigger engines, right? So then, and also, let's think about some other bigger factors from the environmental size. So let's think about that, the car market. So if you have some issues in export, import of the other cars, right? Or maybe the availability of the raw material, right? Think about nowadays we have the Ukraine-Russian wars, right? And then we have some shortage of the raw material. So then the car price can be changed, right? Or COVID-19, right? So borders are closing, we cannot have the trade. So then, many parts of the United States, they have the increase of the car prices. Or TV commercials, right? Or just think about the K-pop or national or company images, right? So that kind of thing is also related to price, right? So then once we want to make this kind of equation, then sometimes we need to select out some of the variables, or we don't study that kind of thing, because studying everything all together in one model maybe is really big, difficult, right? So this is the kind of the traditional, the criticism of the traditional quantitative analysis. Okay, but compared to traditional method, agent space have some kind of the merit. So agent space model, which is sometimes called with lots of the different names, like cellular, automator, multi-agent model, and etc. So all those, actually, the names are almost quite similar. But the research topic or research scope or the variables are a little different. But anyway, all those words are quite similar words. So agent-based modeling here, I can say ABMs. So it is among one of the computational model. So basically, it is the computer simulations, okay, in which we have lots of the interactions among individual entities, and then their structures. Okay, so that's that. So this is the image of the one of my model today, but I will talk about it a little bit more. So this is another type of the computation model. So this is the system dynamic model. So system dynamic model sees the social phenomena from a little bigger unit. So for example, a company or a city, society. Okay, so for example, in here, the population, the number of the total population is controlled by the birth and death, right? So this is the whole Hong Kong, right? We have the population, and then we have the birth and death, and then there is some procedures in here. So this is more like system dynamics, the structures. And then the second one is the network model. So in here, we really focus how the component of the model is related to each other, okay, or what kind of the structure of the network they have. So for example, this is the one examples of the Hong Kong's COVID-19 spread. So in here, you can actually model like you have the number 1, number 2, number 3 patient. So then this patient is related to number 10, number 100, like that. So if you see that kind of thing, really network thing, that is that. Okay? And then the third model is we call discrete event simulation. So as you can see here, as the word it is, so this simulation is actually replicated the event each by, step by step. Think about you are working in manufacturing companies. So then all the procedure is step A, step B, step C, like this, right? So in here, so for example, if you have some raw material arriving here, and then deliver process 1, process 2, so then you can make some kind of simulation. So that is the discrete event simulations. But the agent-based modeling is you see some social phenomena. The focus is that you are seeing the social phenomena. but the social phenomena is coming from the interactions of the smaller level of the agent. So for example, here, we are wanted to see the COVID-19 spread pattern. Then where the patterns come from? It is people's interactions in daily life, right? So the focus is a little different in here, but general logic is quite similar each other. So this is the computation model and agent-based model. Yeah, so this is some of the strengths of the agent-based model. So again, the first one is it can simulate the heterogeneity of the individual agent in dynamic interactions without excessively turning the reality down, right? So again, let's think about some theoretical model in economics 101. When the classes we will learn perfect competition, right? So think about that, the assumption of the perfect competition thing. All the company, all the people have the same level of the information, and there is no geographic variations in there, right? So absolutely abstract reality, right? So we cannot model some different things. So what if you are running more about the macro, microeconomics later, then that assumption is released. But generally, when you study this kind of thing, then you will have very strict the assumptions like that. But when we build like agent-based model, we can have very different type of the person. This person can be a kid, this can be old people, this can be a restaurant, this can be a school, this can be department stores, okay? So like that. And then the distance can be 1 meter, 2 meters, and 3 meters, right? So we can have very different aspect of the reality in the model. So that's one good thing of the agent-based model. The second thing is many rules or decision-making procedures in the model can be based on lots of the theories or data. So for example, when we wanted to model the COVID-19 things, right? So we have very different aspects of the COVID-19. So for example, once we have the wearing mask or without mask, right? Work from home and not work from home, right? That kind of thing we can have in our model. So that kind of thing, right? Again, can be based on real life, the empirical, the cases, or something we really wanted to test based on the theories, right? And then the last one is, so agent-based modeling has quite good the possibility in visualizations. So making the model might be a little difficult, but sharing this model with some people is somewhat effective or somewhat easy to communications, actually. So once you have the model, right? So then once you can visualize your model, then it can be some communication tools to talk with specialist or non-specialist. Okay? And at the same time, now the agent-based model, the community, they have built some one standard procedure named group model building, in which the other different types of the stakeholders working together to building a model. So this is an example of the working model. I will explain a little bit more later. Right? So those three things is a little different things of the agent-based modeling compared to the traditional approaches. So now I will share my experience of the building COVID-19 Omicron wave interventions in Hong Kong. So you know that all the background of the Hong Kong's Omicron during in this, especially in February and March, right? So we all understand how SARS trauma is remember strong in Hong Kong, right? So when I checking the record, the case mortality of the SARS is 17%. The Omicron cases, especially older generation, is 9%. So yeah, you can definitely think that SARS is really, really dangerous. Strong public health challenges in Hong Kong. So we definitely understand that. But anyway, the Hong Kong government interventions were quite effective, I could say, right before the Omicron wave. Before that, Hong Kong government, I think they very successfully prevent all the influx of the virus from the imported cases. So we could enjoy relatively lower prevalence of the COVID-19 until the February times. But probably there may be some kind of the reasons, maybe the Hong Kong government just overlooked the importance of the vaccinations, or there is some miscommunications about the vaccinations and whatever. But anyway, we had quite lower vaccination rate at that time, especially among the elderly. And then elderlies become the victims of the Omicron at the times. And then just remember at the times, lots of the media report about that, the compulsory universal testing or citywide lockdown, when we'll be there, we will do it there or not, something like that, right? So we have lots of the uncertain issues at the time. And then, yeah, the scientists try to making some kind of the simulation model to predict the Hong Kong's Omicron at the times. And then our team is also wanted to making, the simulation model with what we have at the times. So our research is starting from these two questions. The first one is, yes, at that time, we had quite many agent-based modeling in here in Hong Kong and at the same time across the world. But what we found is actually the geographic representation maybe have more room to improve, because lots of the model is aspatial or with very low local level of the geographic the data. And at the same time, we also thought that many of those agent-based model is built in 2D, so X, Y, longitude and latitude. But we are living in Hong Kong, right? Even same X, Y in here, we have 5 floors, we have 10 floors, and even 50 floors, right? So then maybe that kind of the approach may be not accurate to predict COVID-19 spread patterns. So that's one of our questions. And the second one is, the many studies actually based on lots of the assumptions or some hypothetical facts. It is understandable because COVID-19 is relatively new social event to human being, so we don't have that many data, but we have some data already in there, especially from the government side, public data. So for example, human mobility data or population characteristics based on the census data. So in here, we really wanted to use more public data to building a good agent-based model to simulate the Hong Kong's Omicron. So from that two perspectives, our studies have started. Okay, so then I will present more details of my modeling here. So in agent-based model community, we have one guideline named ODD protocols, which is Overview, Design Concept, and Details Protocol. So when you build a model, agent-based model, and then when you report this to other person, especially when you're writing a paper. Now many scientists recommend to use these protocols because now the science community really, evaluate the research. Research should be reproducible, replicable, and also explainable to other people, right? For the integrity. So they make that kind of the structure, and then when you share your model, just using this kind of the categories and the structures like this. So this is why I just wanted to use this protocol to share my data in here, my models in here. So the purpose was, so again, I already explained the background of my research, but again, this image actually represents the basic concept of our studies, right? So most of studies are focusing 2D model, but we just wanted to have more 3D structures in our model. And then the second entity, the stated in scale, means what kind of the agent you have, what kind of environment you have, and etc. So in our model, we have individual persons. And then this individual person will go to POI, point of interest, which means lots of the daily location, things like restaurants, schools, and jobs, and etc. And then each people, they have two different states in the model. The first one is people will move or not move, okay? So mobility patterns. And then once they have that kind of mobility patterns, then they may have some different probability for being infected, contact and then infected to the viruses. So we have two. So mobility status, in the meanwhile, you can have the infection status. Okay, so then that's that. And then the scale means how you can narrow down or scale up the your model. So in our model, which is really geography model, so you can really down to the each individual in some locations, or you can have the street block or district or overall city levels. You will see later. And then number 3, process overview and scheduling is we can just generally explain what will happen in the model. So again, the people will move, in their following their mobility patterns, characteristics, and then they will have the chance of the transmissions. And then, if they go some different locations, they will have different probability of the airborne transmissions, and then that kind of all the activities will be recorded in the model. Okay, so now you can have some general, the idea of our studies, right? And then this is the design concept. So again, we have kind of, two, but we can say, have some 3 pictures in here. But anyway, so first one is, this is human mobility, the submodel. So from some time, you will be staying home, and then you will go to lots of the different locations, and then you will back home. So that's your daily mobility, okay? And then, each locations, you will have different transmission probability, which will translate into SEIQR, infection submodel. So this is quite frequently used model in public health when you're studying the infectious disease. So first you are exposed to virus, you will be just susceptible before infect anything. And then once you have the exposed to viruses, and you will be infectious, and then go to the hospitals, you will die or you will recover, and then coming back again, or you will end of the process in here. And then all these procedures, actually, you have lots of the parameters. The being, even you have the cross contact, you are not infected, then you will be here. But if you have a contact, then some probabilities you will be going to infectious status, right? So this is the basic design concepts. Yeah, and then in here, the scenarios we modeled is actually we have 4 different types of the scenario here. The baseline is actually very similar to what happened in reality. So there is no other specific interventions except we have gradual increase in daily booster shots administration at the times. So so just think about it. The scenario 1 is just what it happened as it is at the times. And then this scenario 2, 3, 4 is actually we try to model the hypothetical situations. The first one is we do the universal testing without lockdown. And then the scenario 3 is we do the universal testing with citywide lockdown. And then scenario 4 is the same as the scenario 3. So we'll do the testing and then lockdown, but the time is different. So in here, from 26 March to April 3rd is at the time, lots of the media reports say that, probably we will have the lockdown at the times. So that's that. And then this one is when we build this model, we found that this could be a peak time over the COVID-19, the Omicron infection at that time. So we just assume that what if we have that kind of things in this peak time in here. So now you have some sense that what kind of the scenarios we did in our model. Yeah, and then, this is more details about all the modeling things. So probably, some of things are overlapped. So I just wanted to say in here, you may think about that is, the stochasticity. So, once you make this kind of the model, right? So then, in some sense, all the behavior is very deterministic with this, the variable. So we wanted to have some randomness in the model, okay? So that's why in the model we did keep some kind of ranges over the parameters in there. And then the travel, the origin and destination. For example, you are going from home to some restaurant, then actually we keep some kind of randomness in here. For example, you can select random restaurant in one street block. So this is because of the data. But anyway, so we did in that way. So for example, so if you are, so in the data structures, actually we only have these people is going to home to restaurant, and we don't know what type of the restaurant they are going. But but definitely what we can know is the street block, the number, okay? So then this agent actually can go to random the restaurant in the street block. So then we have some kind of small geographic things. At the same time, we have some randomness in our model. So that is that. Yeah, and then the day one model, we have the initial 14 the COVID-19 patients in the model. So that 14 is actually we had the very first day of our COVID-19 in there. So we actually read lots of the media reports, and then the media report said that, this patient is located here and there, and then we compare with that with the government report, and then we finalized these 14 people is the first batch of the model. So these 14 people have the COVID-19 viruses in model 1, and they are moving. Okay, so then this is how the COVID-19 is spread in our model. Okay, and then this is the whole list of our model. So basically, the two important data we use in here is first one is travel characteristic survey 2011. You may think 2011 is a little old, but this data is collected almost every 10 years. So probably this data will come out version 2021 or 22 in probably 2023 or 24. So anyway, this is what we can have most in Hong Kong in terms of the mobility data. But this is quite good data. Yeah. The year is a little old, but at the same time, it has lots of the details. You have the ages and the jobs and then all the whereabouts from here to here and there to there. So that's one thing. And the second one is definitely we need to use the census data to making the populations based on the traffic surveys in here, and then lots of the locations, and then the building use, right? That kind of thing is we can also have the Hong Kong government website, and also lots of the other data sets from the COVID-19 and ventilations, indoor side especially. We are heavily using this kind of resources. Yeah, and then if you can read all those tables, seriously, then you can definitely see what kind of parameters and then subcategories is used in our model. And then the analysis is performed using the AnyLogic, the version 9, and then we use this, the spec of the computers. And then once we have the data, then analysis result, then we are using the QGIS for the other geographic mappings. Yeah, so then I will show how this model is running like this. So maybe we can skip some. Yeah, this video was created by the two of our research assistants, Ken and Shangni. Yeah, I think we can pass it. Yeah, so as you can see here, right, some red one is already like infectious status. They are moving somewhere here and there. Then they can spread virus to nearest persons. Okay, and then they go back and something like that. So in here, you can actually change different, the percentage in here. So you can put in your 0% of people work from home, 100% people working from home, right? So the vaccination effectiveness is 100%, 0%, something like that, right? And then how many people wear the mask, 50%, 20%, something like that. And then we can actually accumulate all the data by the district, or if you want to strict block, you can do that. Okay, yeah. So this is how the agents are moving around, and then have the infections. Okay. Yes, this is a summary of the result. So scenario 1, 2, 3, 4, 5, and 1, 2, 3, 4, and then we have the different numbers of the peak times of cases, disease populations, the Omicron wave will end or not, second wave will coming or not, total impacted populations, and then hospital waiting times like this. So in our assumption, the model is most similar in scenario 1 is now most similar in our reality. So so as you can see here, we have another wave of the Omicron recently, right? So especially in our model, we expect it's November, so it seems like quite similar. And the total impacted population is yeah, this is the 1 year running of our model. So we run like that February times to next year January time in the model years. So we have 2.5 million. So now when I just checking the Hong Kong government report, and we are now having 2.1. So we still have 2-3 months more to until the February 2023. So probably this number is quite similar in the reality. So then we can say that our model is relatively quite okay. We can say, and then definitely you can say the scenario 2, 3, 4 is we have more preventive interventions, right? So definitely we can see the decrease of the numbers of the disease people, and then total number of the populations like that. Yeah, and then this is the parents. So the red one is the scenario 1. So as you can see here, quite similar, like this. Yeah, and then in terms of the spatial, the perspective, it is quite difficult to see because we have so many different cases and number of the street blocks. But when you compare those formats, some areas, most of those areas is quite common. So that means actually some areas are really, really problematic under what kind of whatever scenarios in there. But probably those areas have more poor populations or mobile populations or more old generations living in there, probably. But at the same time, you can also see that some areas are actually moving, it's not having that kind of issues when you compare them differently, especially the Kuntong areas. Okay, so that's that. So based on our studies, we actually have this kind of these questions. So the first one we could say, based on our model and then what happened in Hong Kong at that time, so we may say that the Hong Kong's interventions was not that effective because around this time, the real death number is 2,656. But our model estimation, it was 1,450. So it's 1.8 times higher than our model. So yeah, definitely our model is not perfect, but at the same time, there might be some issues that effectiveness of the Omicron interventions at that time in Hong Kong. Okay, and then the second one is when we compare the scenario 2, 3, and then 4. So when we do the strong intervention, the peak time, we actually see that really, really decrease of the number of the infected populations in here, right? So, yeah. So then our recommendation at the time was actually, okay, if you wanted to do that, just do as soon as possible. Don't making any other, the uncertainties, right? So that's that. And then third one is actually, yeah, Omicron can be bounced back again, as we observe nowadays. Yeah, so then probably we need to have some kind of the flexible, resilient interventions, right? Not just dynamic or zero COVID or something, but we need to think about the other ways because the virus is more contagious but less fatal, right? So these three things we can actually see based on our research. Yeah, so our study is actually having some strengths and then limitations. So our strengths, we can say that, okay, definitely we use the 3D framework and then we use the public data. But the limitation I could say is actually, okay, your data is relatively outdated, right? And then at the same time, when we did making that randomness and the stochasticity, so that is actually happen some random things in there. So it is not really 100% reality. So that might be a limitation. And then the number 3 is the challenge is to visualize in 3D way. So basically, I said that we use a 3D framework. When we show you our result, you just see that the 2D map, right? So this is because of mostly because of the software issues, not our issues. Because if you wanted to making all the 3D things and everything, then you need a really, really fancy data for the visualization purpose. So that is an issue. Okay, so this is our strengths and limitations of the studies. Okay, so this is the end of the Hong Kong Omicron studies, and then this is the food security issues in Columbus, Ohio. I conducted in my postdoc training at the Washington universities. So again, I just roughly following the ODD protocols. So this is the Columbus, Ohio, and then they are really big issues of the food security issues. So this is actually state capital, but they have almost 18% of the people have the food insecurity, which means you have some issues in securing the enough food in 1 week times. The U.S. general is 13%, so it's quite high. So when I arrived in there at the Washington universities, they already initiate some kind of the research collaborations over the faculties to deal with these issues. And then when I already arrived in there, they already conducted some household surveys and then store the audits. So this is about the population, what kind of food you have, or what kind of level of income you have, that kind of things. And then store audit means they really visited all the stores and then what kind of the food is already there or not, that kind of stuff. So they have this kind of the data, and then they wanted to conduct some other type of the study. They already mapping where is the food insecure populations, and then which supermarket is good, or which area have more convenience, and etc. But they wanted to do more using this kind of data. So this is why we study this kind of things at that time. So this is the group model building we tried when we built the model at the times. So we invited lots of the stakeholders. For example, the food bank, the operators, or agriculture professors, social work specialists, or the government people. So around 10, 20 people really having a high position or middle position, low position. So we have some kind of the diversity. As you can see here, we have the gender balances in here too. Yeah, so then we ask them that, okay, what do you think, which is really important issues of the food security in this community, and then what kind of the variables you wanted to model, or what kind of data you may provide us, something like that. So we ask them, have some discussion, and then making some kind of the basic conceptual model structures like this. So we divide the two teams like six persons, and then we make the two models, and then we compare each other and then have some discussions like that. So then finally, we could make this kind of the conceptual model to simulate people's food purchase behaviors. So if you are at home, you need to go to the shopping, then you think about your income level, high or low, and then, so in America, having a car is really big, important issue. So then we can categorize 4 different types of the household, like, so you have enough money and then having a car, and then low money and then no car, like this. Right? And then when they select the stores, okay, I will go to the supermarket or nearby the convenience stores. So then go back home. Yeah, again, this process happening again and again and again. So all the, this structure is actually based on their discussions, and then data availability at the times. So again, this is details. Yeah, those two is already collected by the Ohio State, and then those three is another supplementary data. Yeah, and then in here we have that many households, and then that many supermarket and convenience stores. And then once you go supermarket, then the model structure is if you go to the supermarket, and then that supermarket have 100% recommended item from the the U.S. government, then you can have 100 points. But the supermarket only have 50% item, so you only have the 50, and then all the number is accumulated again and again by monthly. Then that score is your status of the food security. So all these things like how many times you are going to the shops. So if you have a car, you can move it that fast. If you don't have car, you move in this fast. And then if you have car, actually you have 100% items, right? But if you go, the stores by walking, it is very difficult to, carrying all the items with the beanie bags, right? So then you can have relatively limited capacity of the carrying items. So like in that way. And then if you are going to more supermarket or convenience stores, so we have all this kind of thing is actually coming from that data. And then in here, based on their data, supermarket has this kind of variations. So 80 to 95% of the items is possible. But when you go to the convenience store or partial market, it's 20 to 55 like that. Yeah. So then the scenarios we had here is actually, if you wanted to go more supermarket, or if you have more items in supermarket or convenience stores, or if you have a higher income, what will happen in your food, the availabilities by the household. Yeah, so then again, when you see this model, so yeah, we have two different stores here for different types of the household. You can change the scenarios here and here, or you can click this thing, and then you can scenario, and then the result will be collected here in all the graphs. Yeah, and then this is the result, and then so then based on the result, we could make this kind of map. So those area is actually the red area is really, really not good in terms of the food availabilities. And then those map is actually, in the data set, they say that, we are food insecure or food secure or food insecure already in their, the survey respondent. So then we divide it in this way. So overlaying those two maps, then we can definitely identify that which area is really, really problematic in terms of the food security is in Columbus, Ohio. Yeah, so then, that's what happened. So based on my research experiences, so I always find that this is some kind of the weakness or challenges of the using the agent-based model. The first one is, software, the coding, devices. Again, definitely, it is doable. I'm not a computer scientist. I'm very, very low level over the, the computer skill, maybe I could say. But anyway, I can do if learn a little bit more. But definitely, I can say this is a little challenging. And at the same time, the software, some software, commercial software we use is quite good, but it is a little expensive. But if you wanted to use the open source data, the software, the function is relatively not that good. So still, this is kind of the issue. The second one is, data. If you have data, you can have more reality reconstructed in your model. But if you don't have the data, then you need to have lots of the assumptions and hypothetical fact. Then this is really, really a little different from the realities, right? And then the number three is, this is what I always, see from the floors or journal reviewers. If you like simulation model, they believe it. But if you just don't like it, they just don't like it. They have still very strong personal preference of these modeling strategies in the academia. So those three things I can say is like kind of the weakness and challenges. And then future directions, the one, the different thing is actually, we can do, different model or different areas and then different topics, right? And then also we can do using, lots of some other, the perspective we can do with the Asian voice model. And then number, maybe this one on 5 is, we can do more like this participate group model beings with the stakeholders. And then this one is actually quite important things. Actually, this Asian-based modeling or all this system, science model, it can be combined each other. So for example, so in our model, so we have only the 20 persons in 14 persons in day 1 as an initial patient, right? But if you can combine system dynamic approaches, for example, the Hong Kong government allow every day 20% imported cases in your model, or 2,000 persons, right? So then your initial batch of the patient will be changed, right? So then you can see that different, right, the border control policies can influence over the COVID-19 pattern in the person or community. So you can do some hybrid way of the modeling in the future. So many scholars already start in that way. So that is kind of the future, I can say. And then if you want to learn more about that specific software I use, AnyLogic, so if you go here, their website, then you can have lots of the resources out there too. I actually start from here. So you can actually learn more. And also if you have some questions, definitely I can help you. And then, this is some examples of our coding strategy. So for example, this one is like about how this virus can spread in some space. And then this one is all the procedures, how we identify some random restaurants in some street block. You can see this is quite difficult to read, and then you think it's quite complex. But once you understand the logic, then definitely you can do some some of the things a little you need to be a little more creative, or you need to be more you need to have more technique, especially in this AnyLogic software. You need to have the Java the knowledges. But if you want to use some other software like net logos or the repass and that kind of thing, the Python is quite good languages you can use. So again, so this is the final message. So ABM is quite the flexible, and then you can have lots of the different aspects of the reality in the model compared to traditional analysis. So that is why I'm using agent-based model for my research. And then number 2 and 3 about the Hong Kong Omicron cases and food securities. We can making some kind of the model, agent-based model, replicated the reality. And then this model can be quite good to see the, the real social issues in, those two areas, Hong Kong and Columbus, Ohio. And at the same time, we are using the group model building to make a model, which is quite valuable in our experiences. Okay, this is it. Thank you.
So for the first project, I have a question about the robustness of the model. So because you got a conclusion in terms of the intervention effectiveness, and then you're saying probably the result is the intervention is too, I guess it's not very effective. I guess how much is that result can be subject to the setting of starting date of the disease? Have you tested different starting date of the first case?
Yes. Definitely. Definitely. As you can see here, so our model starts. So for example, okay, we start our model from the January, or we can start this model in February, right? In that way, Actually, if you do that, probably the result may different, but we already checked that 1 week times before, after, and at the times. And at the same time, we are really trying to have the very similar pattern of the Hong Kong's reality at the times. So yeah, I could say our model, yeah, regardless of the starting date, then maybe it's quite accurate, we can say. But yeah, definitely. But again, the 14 cases, we are actually collecting from the newspaper report, basically, and then we compare that data from the Hong Kong's official data, which doesn't have all the details. But if you have that kind of data, then definitely you can making a better, right? Yeah, some already have the data, but we don't. So this is an issue, yeah.
My second question is about the add-on value of the model. So given the complexity of this model, have you ever compared it with a very, very simple like spatial temporal lagged model just to compare the results? Like how much the accuracy of using agent-based model compare a very, very simple linear model?
The first, yeah, this is really, yeah. So, yeah, you actually, yeah, raise lots of really good, the questions about the general agent-based model or simulation studies. Yeah, validation is really important, actually. So, again, I say that this is a believe it or not issue is actually, yeah. So then always, the other traditional, they say that, oh, hey, we have some estimation, the range in here. We have some error, the range is like there. Yeah. So our expectation is may not correct, but we have some ranges and error. So this is our study is quite good. So that's why the traditional scholars, attack the agent-based modeling or simulation things. But luckily, in these cases, in Omicron cases, we could have daily reported every day from the government, right? So we can compare the things. And then our estimation that the graph is quite, I could say, less than 20% of the range of every day. So maybe we can say, yeah, think about our data is already 10 years old, and also the population is 2016, so which is not exact the time of data, but within 20%, it may be acceptable, I think. Yeah. So this is our studies validation.
Another question is more about like the input of the all different kind of agent-based model. Do you need to guarantee that all the factors definitely will be a cause of the result? For example, like in the, this is like for my own understanding of the agent-based modeling. So when you actually input any parameter, do you need to guarantee that that parameter is definitely a cause of the result, of the final results, or you might not need that to be for sure?
So, yeah, so in that sense, so that's why we are now trying to use more the group model building type of the thing. So when we making a modeling, then definitely we can see some parameter is really important, sometimes is really not important, but sometimes it is very difficult to have some kind of data and something like that, right? So sometimes we need to trade off that kind of thing. So yeah, definitely researchers can select, making that kind of decision. But at the same time, if you have your colleague or if you can communicate with other stakeholders, then yeah, you can ask them that you can write in there. Yeah, we try to have that kind of variable in originally, but it's quite difficult. And then we have some kind of consensus with the discussion with the stakeholders, so we just remove this kind of thing, and then this is what we think this is the best reality replications. Then yeah, this is your way of doing that, right? So then again, some people like it or dislike it, but that's what you can do. Then yeah, I think this, yeah.
For the project, oh sorry.
Maybe
yeah.
another.
Hello, I have a small question about. In my opinion, I say the ABM like a framework. You just compare different models together based on some structure. And for your purpose, your research purpose. And in your research about Hong Kong coronavirus patterns, you choose the human modulation models and infiltration model. Actually, we can choose different other models put together with other structures. Maybe final result is totally different.
Right.
And so can you give me some criteria or stage why you choose that model if you want to do something? Because in familiar, it's like because my study also use AG-based model to about policy. When I do the research, I have thinkings about when I build some ABM, I choose different model come together with some structure. Actually, it's based on what I look at these issues, what I look at the problem I want to serve. So the final result is mostly like what I think, because I think you got
Yeah.
So can you give me some because some reviewer think he says he don't like that research. He think you think the thing like this, and you build a model to prove that you can got nothing, the new thing if you use the ABM model.
Yeah.
Can you give us some information common to these issues? And
one advice based on my experience is you need to be a little more patient. Actually, from the reviewers, they comment, when I, my Omicron the study, it is quite short communication because there is kind of urgent times issue. So I actually try to 5-6 good journals, then they all reject because they are more clinical type of, they prefer the clinical side of things, not simulation things. So that's I totally already expected in that way. But this journal, they also embrace this kind of simulation studies. So that's I finally have the publication, but which is quite good journal too anyway. And then also I have the same experience in food security too. So when I submit the paper, then they said, yeah, you made your own world, and how I can judge your world. That was basically the general sense of the comment, right? Then you just pass it on. Yeah, you can choose the other journal, and then you just say a little bit more about your the position, more justify a little bit better. Then probably some other reviewers will like it actually. So again, this doing simulation studies, you will definitely see lots of this believe it or not situations. So if you are lucky to meet some people who prefer this kind of thing, then your process will be good, but it's not good. So that's why again that the group model building might be some the way around that kind of issues, because okay, we expect your criticism like that, but my colleagues and then my other stakeholders, we think this is quite important thing in our community. So this is why we want to study this thing more. Yeah, definitely we can study your perspective later, but this is within, based on this group model building, then definitely the room to be criticized will be getting smaller. So yeah.
Thank you so much for sharing. And I have a question about your innovative point in the Omicron model, because I think you aiding the height of the buildings, like transfer from the 2D to 3D is one innovative point. And could we know some impact or numerical effects of adding these features into the model? Do you have some quantitative results or something like data to reflect this action?
Yeah, actually, thank you for that comment. So then we actually, this is, kind of, for me, it's also my first attempt to using the 3D aspect in the things. And at the same time, this is also quite new to in Asia-based modeling thing, I guess. And then, so this is, we just started this kind of thing, so we need to study a little bit more. So basically what we wanted to do is during the Omicron, the COVID-19 times, there are lots of the report like, oh, this building, the sewage have the issues, right? And then you need to have the compulsory testing for whole day neighborhood and that kind of stuff. Then maybe we can simulate that kind of thing. Then that kind of approach is really make sense or not? for example, right? So think about that. So now we have in our model, we have the Omicron found in 23rd floor. And then definitely the building may have some sewage issues in the COVID-19. But then we need to do whole the area of the compulsory testing. So then we maybe calculate the testing costs and then times and etc. with that, and the effectiveness of the policy. Yeah, so actually that is actually we want to do more about that. Yeah, so we are actually open to all that kind of idea. So if you have some idea, then just suggest to us and we can study more.
Thank you so much. I think it's very typical in Hong Kong.
Yeah, but this one is actually totally based on my graduate student idea. So one day he brought this idea to me, and then, oh, hey, Dr. Ko, I just wanted to making 3D model in Omicron. So then my first response is, why? Can you do that? That was my response, but he did it. And then, yeah, actually, after we building a model is kind of really good. So I think, yeah, this kind of open, minded and working together is, work at this time, luckily, yeah.
Thank you.
Yeah. Thank you very much for exciting research. Yeah, I have been very closely followed. I know some overall structure of your research, but it is my first time to see the full version of it, so really appreciate. I am working on transportation, travel behavior, so because of that, I'm interested in having a little more realistic mobility pattern. So you use 2011 transportation characteristic survey, and I believe in many other cities, maybe they are not as old as 10 years ago, but during kind of COVID situation, no countries can do detailed travel surveys, so they had to use some years ago, past mobility data and assume the overall pattern would be similar. So that is inevitable, and also that is, I guess, the best approach we can do. My question in this case is that during the COVID period, the tech giants like Google and Apple, they free of charge, they shared community mobility reports in an anonymous way. So because of that, they had to aggregate up to county level or regional level or country level or things like that. So I wonder, I believe Google Mobility Report or Apple report was shared at the Hong Kong level. And we have so many small neighborhoods. So I wonder whether there would be some kind of interesting ways to use that information and then some kind of, manipulate the 2011 TCS, because we know that, people didn't visit parks as often, in part because parks were closed and playgrounds or beaches. So there were some kind of policy changes, and also Google Mobility Reports, they had fluctuating patterns depending on the type of destination. So what do you think?
Yeah, thank you, Dr. Lee. Really good, suggestion. So we also actually checked that the Google mobility data, but as you already said that, the level of the data is whole city, so which is a little difficult to directly use to our individual mobility patterns. But again, maybe in the last part I said that we can do the hybrid modeling things, right? So TCS data structure is okay. We are going to home, work, restaurant, supermarket, home again, something like that, right? So then I think some of the category of the Google mobility data is going to staying neighborhood or going to supermarket and etc. So then we can maybe see that okay, Hong Kong government started this social intervention, and then this is how the overall total the volume is changed in this way and that way. So then that is actually can change the individual mobility, the probability. So then it could be more logical. So in our model, we just said that, as you can see here, we are 70% lockdown, right? Wearing 70% mask, something like that, right? But yeah, if we can have use that kind of information, then it could be more realistic, the replications. Yeah.
Thank you very much.
Any other questions? Any other question? Okay, maybe I ask a question. So I'm curious to know, from in general, I can understand agent-based modeling is a very powerful tool to do simulation, and also to much powerful to simulate some hypothetical situation that basically you don't know, you do prediction. But as a social scientist, some of the questions usually we want to test model. For example, we want to know some kinds of individual behavior, whether or not will contribute to some kinds of aggregated overall changes or some of them. So how can we use agent-based modeling in more theory testing cases? For example, especially one is how you may already mentioned, how to match with the real-life data to see how can we claim your theory is right. You just look at the aggregated outcome or how you test the individual behavior. So how can we better use this for general social science usage?
That is a kind of really essential issue for us to select use the agent-based model, right? So this is really that again the believable or not the things, right? So so again that in terms of the food security that paper. So the second one. So if you are suppose that one. So if you are running that 10 years, 5 years, 10 years, and definitely you can have some kind of pattern. So then definitely. Anyway, in the model, you can see some, the variable changes in this time, essentially influence in 5 or 10 years. So if you can go in that way, then maybe you can, do a little bit more about that. But my research focus so far was, just showing this kind of thing with geography. So we are really focusing more about the geographic network, the visualizations more. But definitely once when we making the model more conceptually, then definitely your perspective is maybe more important. So some of the like diabetes or like what is anyway some chronic disease things which can making really mathematical equations. They actually try to do more than individual factors or longer time forecasting, and they do more like in that. But I just come across that kind of thing, but I didn't do that well. So I'm not sure about more about that. But there is there is some people that wanted to see more the principal way of the modeling.
Okay. Thank you. Good. Any other questions? Okay, so then thanks so much for Dr. Cole's your presentation. Hey, thank you so much for attending. So look forward to seeing you in the next round of the Research Hub seminar. Bye-bye.
Thank you.